Hello and welcome to another edition of Talk to the Experts. I'm Betty Jo Kaiser, and joining me today is Diamond Fernandez of HeartFit, the HeartFit Clinic. It's heartfit.ca. And how are you today?
I'm doing very well, thank you.
You're always well.
Yeah.
You're one of the happiest people I know. Definitely one of the healthiest people I know. Diamond is going to share with us today some really great information about heart health. And, you know, we all know someone who has experienced heart problems. We know that heart attacks, absolute number one killer. Mm-hmm. And there's an awful lot that we can do to prevent heart attacks and that just have a much healthier heart. So can we just start right there? What causes heart attacks?
You know, I think many people think as heart attacks is a plumbing system. Like, soon as it starts to clog up with cholesterol, we end up with a heart attack. And that's not the truth. The fact of the matter is that the majority of heart attacks occur, if we take that same analogy of a heart or of a plumbing system, the majority of heart attacks occur where the blockages are less than 70%. So that's pretty dangerous because if you think about it, 70% is this magic number where people will then start to put in heart stents or look at bypass surgery or something to that effect. But the majority of heart attacks, we're talking about fatal heart attacks, occur with people who have blockages that are less than 70%.
So that's shocking. That's surprising information.
Yeah.
If I go to my family doctor and get an assessment, tell me maybe what the difference is. Go to my doctor and say, you know, I heard on the radio about this 70%. That's kind of scary. Could I be at risk? The difference between doctor and cardiologist, maybe. How does that all work out?
Well, you know, with the HeartFit Clinic, we got a lot of great treatment options, and I'll quickly talk about the path of that event. So let's say you're concerned. You have maybe high blood pressure or whatnot. You've
been to your doctor. Your doctor's like, you got high blood pressure. You have high cholesterol.
Or you might even be healthy for that matter. You know, the doctor, the family doctor is great at doing a whole bunch of things. But when it comes to cardiovascular disease, there's only a couple things that they can do. They can look at your blood pressure. You know, they can check, of course, if you're smoking or not. But
lifestyle stuff.
And look at cholesterol. But cholesterol is not the concern. It's the reasons why people end up with heart disease. So you get this kind of, you know, if we take a grade out of school, you kind of get a C approach to what your risk is of a heart attack or stroke.
Okay, average.
Yeah, and it's like what we call something, some people may have heard, the Framingham risk score, and that's what doctors use, and it's old school. And majority of people will walk out of their doctor's office with a physical, yet still be on the path of a heart attack or stroke.
And so, HeartFit Clinic, where Diamond is from, and folks, if you want more information, great website, heartfit.ca, or give them a shout, 403-870-4348. You really dig down deeper. You are getting more of an A-grade reading on where you are for heart health, correct?
Yeah, absolutely. And I'll go through those tests quickly, but it's even those people who have had a heart attack or a heart disease where we can really help those people too as well. But let's go on that path. Let's say the family doctor's not quite sure and they want to kind of dive into it deeper. So let's go to a cardiologist.
Yes.
And the cardiologist is great. You know, they'll look at a little bit more in depth of what your risk is of a heart attack or stroke. But the fact of the matter is they might do an echocardiogram, which is an ultrasound of the heart, or they might even just do a stress test. The problem is, and I just mentioned this before, is that the majority of blockages actually occur with, the majority of heart attacks occur with blockages that are less than 70%. So if we look at that, the diagnostic test that cardiologists use, which is a stress test majority of the time because it's a non-invasive quick test to use, it'll only show advanced stages of the disease. So you have to have a higher percent blockages. Then they might go take you onwards to an angiogram or a heart stent or bypass. But we can help you with that as well. But you know, you could walk out of a doctor's office, a cardiologist's office, still being on the path of a heart attack or stroke.
That's really scary.
Yes. And in the event that you are, let's say, at risk, a lot of doctors a cardiologist might consider a heart stent or bypass surgery when external counterpulsation therapy, which is something that we offer, that we'll get into here shortly, to help people treat heart disease is probably a much better option for that. So.
We are going to get into that a little bit. I just want to remind everybody, this is Talk to the Experts. I'm Betty Jo Kaiser. Joining me is Diamond Fernandez. For more information on the HeartFit Clinic, you can go to heartfit.ca or call 403-870-4348, 1-877-700-4348. So can you just help us understand a little bit more about why do people get a bypass? Why do they get a stent? And then I want to go into the treatments that you can offer.
Yeah, and I think we got some of the best treatments in the world, I think, for treating heart disease. And if you've had a heart stent or bypass surgery, this is something you definitely want to listen out for, because heart stents should be used in a specific situation. And in my opinion, in the best outcomes, and we learn this at all the cardiology conferences that I go to and whatnot, and it is heart stents are great to use when someone's having an acute event.
Right. It's emergent.
Yeah, it's emergent. It's an emergency. We need to open up that artery as quick as possible. That's where heart stents are used at their optimum. That's where they're used at their best.
Okay.
Now, bypass surgery should only be used, again, if patients have what we call that widowmaker artery problem, that left main disease. That's when bypasses, I think, are excelling the most, or if you have diabetes. But there is a better option. And we do external counterpulsation therapy. And I'm not trying to dismiss the fact that people should have heart stents or bypass surgeries. That's not what I'm trying to say.
Absolutely. There's a place for them.
But
life-saving.
Yeah. The reason why people should have heart stents or bypasses is to cure symptoms, is to I should say, delay the onset of those symptoms. Because,
kind of like a Band-Aid, sort of.
Yeah. I mean, we have 60,000 miles of blood vessels in our body. We're focusing on one little segment of the artery here that's blocked. And so when you have a heart stent, it's great to have it if you have that acute event. But if you have what we call angina, which is chest pain, or you can experience it different ways. It could be shortness of breath. It could be jaw pain, shoulder pain, whatever it might be. But you have this, what we call diagnosed angina. We know that you have heart disease. Well, heart stents can open up that artery and help that out. But it will not cure that problem. You still end up with, the problems happening down the road. And it is surgery at the end of the day. And it's what we call elective, meaning that you're going into the hospital on your own volition and going into the hospital to get this surgery done. Yes, there's a time and place for this. But before you end up trying to do that, I think external counterpulsation therapy might be a better option.
External counterpulsation therapy. It sounds very sophisticated, sounds very scary, but in fact, it is an incredible treatment that's only in Alberta. Only place you can get it.
That's correct, yeah.
Is at your HeartFit clinic, heartfit.ca. Can you give us the rundown of what this treatment is? It's phenomenal, folks. If you know people that have had to fly down to the Mayo Clinic or the Cleveland Clinic to treat their heart disease, this is something you need to really listen up for. You don't need to get on an airplane and go south.
Yeah.
You go right here in Calgary.
Exactly. And we have, I think, the best treatment in how to treat heart disease as well. I mean, yeah, we have this bed, which is a great treatment for heart disease. This bed has been used all over the world. It's US FDA approved in the States. There's many, many clinics in the States doing it. It's
been around a long time.
Absolutely.
This is not some brand new, crazy. This has been proven as a very effective treatment.
Absolutely. Used in the Mayo Clinic, the Cleveland Clinic, John Hopkins Center. All these places have ECP therapy.
And so in a nutshell, we're going to get into more detail later in the hour, but what is it in a nutshell?
In a nutshell, it's a treatment to help people cure their angina, cure their symptoms of heart disease. So it's really meant for patients who have a blocked stent or bypass surgery, or not amenable to a stent or bypass surgery. You have those blockages that doctors might have left alone, what we call multi-vessel disease. So this is a great treatment for those patients.
And it's a bed, and there's cuffs, right, along the bod, and it squishes your muscles a little?
Yeah, it's non-invasive. It's completely painless. There's no radiation. There's nothing like that. So it's a completely safe, non-invasive, non-surgical treatment for heart disease.
Oh, and I got to tell you, we had a chat with Harry, and life-changing. Like,
absolutely.
The amount of energy and excitement in his voice and how wonderful he felt following the ECP treatments is really remarkable. So we'll talk a little bit more about that. We do have to take a break. You are listening to Talk to the Experts on News Talk 770. I'm Betty Jo Kaiser. Joining me today is Diamond Fernandez. He's with HeartFit Clinic. You can find out more at heartfit.ca or give them a call, 403-870-4348. Long distance, 1-877-700-4348. We will be back with more right after this. Welcome back, Diamond.
Thank you.
So, folks, if you are one of those people, maybe you have a history of heart disease. Maybe you know a couple of people that have either had a heart attack, they have high blood pressure, and you're just concerned about your overall health. Sure, you have a great family doc. They do a great sort of overview of your health. They take your blood pressure. They do the basic blood tests. But you really are looking to find out more about your heart health and improve your heart health. Maybe you've had an event in the past. Maybe you've had a minor stroke or a heart attack. Maybe you've had angioplasty. You know that it's out there. That heart is such an important muscle. It makes it all work. If they were to call up HeartFit Clinic, tell us a little bit about what you do. Can you walk us through the whole process?
Yeah, we have this external counterpulsation ECP therapy treatment, which is great. But before we even do that, we do a very thorough risk, which anyone can do. And the idea is to find out, where are your markers for heart disease?
So this is risk assessment.
This is risk assessment. So we do a very thorough assessment that you will not find at your family doctor's office. And so we do, the first off, of course, we take a history on you to see where your risk is of a heart attack or stroke with some conventional risk factors. But this is the cool part. We go dive in deeper to things that you will not find at your doctor's office. So the first one is we do some artery screening tests.
Oh, cool.
Yeah, and it's really cool because we look at the arteries and we see basically what is the age of that arterial wall. We look right inside the arterial wall, which is safe, painless, there's no radiation. And we look inside the arterial wall and we see what the age of that artery is. So that's one of the tests we do. Then another test we do is to see basically how healthy or how reactive are your arteries. Because your arteries should be very reactive. They should be, the best way I can say it is if you left a garden hose out all winter long, yeah, it's hard. And it
feels like you could crack it.
Yeah, exactly. Your arteries should feel like a brand new garden hose, nice and elastic and movable, just
bendable,
freshly bought from Canadian Tire.
The water splooshes out beautifully.
Yeah, exactly. So we do a test to see how healthy or how reactive are your arteries.
Okay.
And so those are some really great tests to see how your arteries functioning and how old they are. The next test we do is we do a lot of extensive blood work, and this is blood work that you will not find again at within our Alberta Healthcare Services. So we do some genetic markers for heart disease, and we do some inflammatory markers for heart disease. Because remember how I talked about 70% of heart attacks occur with people that have blockages that are less than 70%. So let's dive into it. The reason why that is because it's like inflammation. And the best way I can say it is, imagine you have that cholesterol building up and then you end up with a pimple. It just quickly inflames. It gets really big. Well, imagine that going on inside your artery. That's what inflammation does.
Yeah, it swells.
Yeah. If you think about cholesterol as the kindling, in a fire, and you think about inflammation being the match.
Okay.
And that's the dangerous combination with that. Cholesterol, of course, we know it's not the cause of heart attacks. It's actually we got a protective mechanism. And so we do some in-depth cholesterol markers for heart disease. Because everyone thinks that we know we have the good cholesterol, the bad cholesterol, and the ugly cholesterol, which is, HDL, LDL, and triglycerides. And you can get that done at your doctor's office. But what we look at is more in depth what your cholesterol is looking at. We look at the small particles and the large particles. And I like to call them the golf balls and the tennis balls. And if you imagine that your artery is protected by a tennis net, golf balls can go through that tennis net and cause damage. Tennis balls won't. And so we look at that. We look at the cholesterol more in detail. We look at some key inflammatory markers for heart disease, again, that you won't find at your doctor's office.
When he says we, he means the HeartFit Clinic here in Calgary. It's heartfit.ca, or give them a call, 403-870-4348. I'm Betty Jo Kaiser. Joining me this hour is Diamond Fernandez of HeartFit Clinic, again, heartfit.ca. And we're just talking about the assessment, which is really in-depth. The first thing that happens when you give these folks a call and say, yeah, you know what, I need to know more about my heart health. Mm-hmm. I've got kids and grandkids, and I want to live a long and happy life, and I've got the means to go one step further. Mm-hmm. And the HeartFit Clinic offers that. So we're talking about these down deep assessments that you're doing. So there's extra blood work you do. You're taking a real close look at the veins.
Yeah, we're looking at a better look at the arteries, how they function,
right,
how old they are. And at the HeartFit Clinic, we also look at your fitness. I think your fitness level is very important. I think exercise is the best medicine, and that's what we do. We do what we call, the best way I can say it is clinical personal training. And it's for we exercise with patients to make sure everything's safe on a clinical perspective. So we're looking at blood pressure, we're looking at heart rate, we're looking at your ECG while you're exercising to make sure it's a safe and effective level of exercise that people are doing.
That's a really good point.
Yeah.
Because I have been going for walks ever since I met Diamond. I've been going for walks almost every single day. And some days I'm up to way more. And I do worry. I feel myself getting a little bit more short of breath. And I wonder, I'm like, oh. And I think about you. I'm like, I got to get to that HeartFit clinic and get that assessed, because I worry, because I'm an intense person and I want to work out a little bit more.
Of course, yeah.
But you got to be careful, right?
Yeah.
Especially if you're overweight, or maybe you're a smoker,
Yeah.
or you've got other issues. You guys also do nutrition counseling, right?
Yeah, exactly. We look at nutrition more in depth. We look at your exercise levels. We look at stress. And stress is a risk factor that is really important, because it's not a number that we can give to somebody. So it's important about looking at that, obviously into anxiety and depression. But even before that, keeping stress under control is very important.
Okay, you've done the assessment. You've taken a look at the heart health of the individual. Then it's time to create a plan for them.
Absolutely.
And so that plan will include nutrition, exercise, and for some patients, for many patients, ECP, which is external counter pulsation therapy. Only place you can get it in these parts is here in Calgary at the HeartFit Clinic, heartfit.ca, if you need a little bit more information and you're just getting in and out of your car. Tell us more now about ECP, this external counter pulsation therapy, something that not that long ago folks would fly down to the States for. No need to do that anymore.
Yeah,
they can get it here.
It's a safe, painless, non-invasive, and non-surgical treatment for heart disease. And so, and it's clinically proven. It's not a hocus pocus type of thing that we're looking at. Many patients might consider on an alternative level maybe chelation therapy or some other aspects. We can get into that in a little bit later. But chelation treatment is not a clinically proven treatment for heart disease, although I've seen some great outcomes from that, and there's some evidence to show maybe it's starting to get a little bit better. But the fact of the matter is that ECP is a clinically proven treatment for heart disease. It's not something that was just invented yesterday. It's been around for many, many years.
And so what exactly is it?
So what happens is that patients lie on a bed, a comfortable bed, and they got these blood pressure cuffs, these big, large blood pressure cuffs that go around the calves, the thighs, and the buttocks. And while you're on this bed, we hook up an ECG to you. And why we hook up ECG to you is because these cuffs sequentially inflate and pump blood back up the body according to your cardiac cycle. So as your heart beats, it relaxes. When the heart's relaxed, then all these blood pressure cuffs contract and pump blood back up to the heart.
So does it kind of feel like a little bit of a massage?
It kind of feels like a massage, and that's the best way I can say it. I mean, I'm doing I like to do the treatment personally, and I don't have heart disease, but it makes you feel good. It's a really great feeling experience. And so when this blood pumps back up to the heart, you have a massive amount of blood flow that's be able to pump more out to the body. Because remember, you have 60,000 miles of blood vessels that you can help with this type of treatment.
That's a lot of miles.
Yeah. And, this treatment is basically used, we use it at the HeartFit Clinic for the treatment for heart stents or bypass surgery, people who are not amenable to that or failed. I can't tell you how many times I've seen these, it's not a cure. Heart stents and bypass surgeries are not a cure. It's a treatment option to be able to help people with their health. It comes with a lot of risk. And like we talked about earlier, I think those treatments are great if you're in an emergency. If
That's
you're
right.
not, ECP therapy is a much better option to try first to make sure it's amenable to you. And we talk to everyone, make sure we do a thorough assessment to see where their risk is of a heart attack or stroke that way too.
And how long do you lie in the bed for and get the blood pressure cuffs?
Yeah.
Get the blood flowing? An hour?
Yeah, you lie on the bed for an hour, and we
Okay.
do 35 treatments of this, and that's the course.
About one a week, or how does it work?
We'd
It
like to
depends
do
on the
it-
patient.
Yeah, it
probably.
depends on the patient, but we'd like to do it as often as possible.
Okay.
35 treatments as quick as possible.
That's optimal.
Yeah. Patients who, and this is a big population of people, and we'll get into who it's for. At the HeartFit Clinic, we're giving people who have angina, which is, chest pain. And many patients are taking nitrates or beta blockers or extra medication to treat their angina. Well, this is a much better option to do that. And we've had patients come off of their pills, minimize their medications for angina because the bed is providing that option. It's able to grow arteries and vessels that you wouldn't be able to get with any kind of treatment.
at the end of the day, a much better quality of life. We're going to have much more in the next half hour. You're listening to Talk to the Experts. I'm Betty Jo Kaiser. Joining me this hour is Diamond Fernandez of the HeartFit Clinic. Find out more at heartfit.ca or call them 403-870-4348 or 1-877-700-4348. We're going to have more after this. Hello and welcome back to the second half hour of Talk to the Experts this afternoon. I'm Betty Jo Kaiser, and joining me is Diamond Fernandez. He is a heart fit expert. He is with heartfit.ca. That's the website for HeartFit Clinic here in Calgary. I'm going to give you a couple numbers. You can reach them. 403-870-4348. That's 403-870-4348. Or long distance, 1-877-700-4348. 1-877-700-4348. If you're just joining the show now, we're talking about heart health and heart fitness. And if you are one of these people who have had a heart event in the past, maybe you have suffered a heart attack, maybe you've had bypass surgery, maybe you've had a stent put in, angioplasty, maybe you have angina, you need to listen up. And actually, maybe you're just one of those people that's feeling the stress of everyday life, and you maybe have heart disease in your family, or you're wondering a little bit more about the condition your heart is in. You'd like to get a little bit more information, get more in depth. The HeartFit Clinic is really the place to go, correct?
I love it. And we've been doing it for many, many years now, and we love what we do. Yeah.
Well, you obviously have a passion for it.
Yeah.
And I think, obviously you want to make people well, but it must be very gratifying to see these healthy, rejuvenated folks who, come in and are just wiped. They're exhausted and they're not well, and go through the whole assessment and then go through the treatment at your clinic and come through on the other side feeling like, wow, like a different person. We just had a conversation with Harry, not on air, and he was so excited about how he felt after his treatments at HeartFit Clinic, specifically ECP, external counter pulsation therapy, which we'll talk a little bit more about. Harry said that it changed his life.
Yeah.
He was exhausted.
Yeah.
He was always cold. Like he was unwell.
Yeah. And it's amazing what you're able to do for these people. And you almost got to take a little bit of leap of faith in terms of what it can do for you. Because if you're sick and tired of being sick and tired, we have a treatment option for you, especially when it comes to heart disease. Patients are taking a lot of medications to treat their angina, or worried about the next heart attack, or worried about even that first heart attack because they've maybe had a heart stent or bypass surgery. I mean, this ECP therapy, external counter pulsation treatment, is a great treatment to help patients, give them hope. And that's what we're doing is we're giving people hope and changing their lives. And the benefits are just remarkable at the HeartFit Clinic.
Hope and a much better quality of life.
Yeah. And, when we talk about heart disease, with ECP therapy, we release nitric oxide, which dilates the blood vessels. So it can have a lot of benefit to a lot of arteries. We'll talk about the benefits later. But it decreases or even eliminates angina. It improves artery and heart function itself. And so you're giving an environment. Your body wants to heal itself. No matter what state it's in, it wants to heal itself. ECP therapy, external counter pulsation therapy at the HeartFit Clinic, is something where we provide the body an environment to heal itself.
You're giving the body exactly what it needs to do its job.
Yes, exactly.
Okay. So once you've had the full assessment and the folks at HeartFit Clinic have given you, the tools you need to help improve your wellness, one of those and one of the main treatments that's offered there, and by the way, folks, the only place it's offered in this part of the world is here in Calgary at the HeartFit Clinic, is the ECP external counter pulsation therapy. So I would like you, Diamond, just to run down the best candidates for this type of therapy, and then we'll walk people through, if you're just tuning in, exactly what the treatment is.
So let's talk about the first category of people. I think angina. Yes, angina is a huge problem in Canada, in Calgary specifically. Patients are not given much hope other than medication therapy. So even you can go visit a cardiologist and they'll be like, okay, well, here's a medication profile that is going to help you at most. So they try that course of treatment. Instead of doing medical therapy, or in addition to doing that, I should say, because ECP therapy will help them with their angina.
I think it's important to note you work really closely with cardiologists and
Exactly.
doctors.
Yeah.
This isn't instead of.
No.
This is an enhancement to.
Exactly. Yeah, it's just a fine tool to be able to help people with their heart health even further. Yeah, we work with a lot of cardiologists to help them, their patients. I mean, we make family doctors look like rock stars because they're sending their patients to us because they were able to do a more in-depth look, and cardiologists love us because in all honesty, they're only able to spend a handful of minutes with you to help you with your heart health.
That's right.
And, and so that's why HeartFit Clinic has been helping people of Calgary and surrounding areas for 8.5 years now. So
Heartfit.ca, 403-870-4348. That's 403-870-4348. Or again, the website, heartfit.ca. Okay, first group of people, angina.
yeah,
Click.
the next one is small vessel disease, or even what we call multi-vessel disease. These are people who have had an angiogram and have those small vessels that are blocked, or they have multi-vessel disease. Now, when you do an angiogram, they might consider a heart stent or they might consider bypass surgery. But if it's non-emergent, that is not the best treatment option. A lot of cardiologists will opt out for what we call optimal medical therapy. And in addition to that therapy, that medical therapy, ECP therapy will be a great option because we've had patients that are doing this that are on optimal medical therapy and have come off some of their drugs that have been causing that angina.
Oh, that's awesome.
So it's a great, treatment for that person. The next group of people I think is great that we help people with the HeartFit Clinic is a blocked heart stent or bypass surgery.
Okay, so they've done this. They've been through it.
So they've already had a heart stent, they've already had a bypass surgery, and now they're starting to feel symptoms of heart disease again. They're feeling that angina. So instead of getting another heart stent or bypass surgery, which did not work, unfortunately. Not all arteries are amenable to a stent or bypass. So they've already gone down that route. It's not working for them. Now ECP, external counterpulsation therapy, might be a treatment for these people.
Excellent. Now, external counterpulsation therapy has been around for a very long time.
Yeah.
It's not a brand new therapy. However, it's fairly recent, available here in Calgary, which makes it fantastic and super accessible because it wasn't that long ago people would have to fly down to the Mayo or Cleveland clinics to get this treatment, correct?
Exactly, yeah. And there's another group of people, there's two more groups of people that I think we can help with ECP therapy. Actually, I should say I know that we can help with ECP therapy. Is the last one is a lot of doctors will leave patients alone that are arteries that what we call not amenable to a stent or bypass surgery, meaning that the arteries are too far down the vessels or they're at a branch where it's a little bit more difficult. They might opt out for bypass surgery, but again, they'll try optical medical therapy. It's what we call patients are not amenable to a heart stent or bypass therapy. Well, you want to have a treatment option. You want to live better.
For sure.
Absolutely. So external counterpulsation therapy can help those people as well. And there's the last category of people. There's those patients who basically have heart failure, and if they're they have a low functional capacity. They do not have a great quality of life. Well, with ECP therapy at the HeartFit Clinic, we can help them with that too.
So they're really tired all the time.
Yeah.
They have a hard time catching their breath, even just taking a few steps, going for a short walk.
Exactly.
And they're really, their quality of life is very poor.
Yeah. And, another category of people, and I think about it, I mean, there's lots of great benefits of people as well, but diabetes, I think.
Okay.
Yeah. If you have diabetes, more than likely you're going to end up with heart disease. I think it's 4 out of 5 diabetics end up with heart disease.
Wow.
So, and their arteries are a lot different than someone who doesn't have diabetes because these stents and bypasses don't always work for these people. And so that's a great category of people because what ECP therapy does, and I talked about this earlier, is if you can take that garden hose and make it look like a brand new garden hose, instead of leaving it out all winter long, we talked about that.
Hard and cracked and inflexible.
With ECP therapy, we're improving the garden hose. We're improving the function of the arterial wall. So what we call endothelial function is specifically what we're looking at. So we're improving the function of the arterial wall. And more importantly, now we're developing blood vessels that are going around the heart that haven't been there before. It's things that you won't even see on an angiogram.
Kind of sounds like breathing like a fresh breath, like
Exactly.
fresh air, like opening up the windows and clearing it out.
Exactly.
Right?
You're getting to everywhere. Like I said, ECP provides an environment for your heart to heal itself.
Right. ECP therapy, external counterpulsation therapy, is available at the HeartFit Clinic here in Calgary. Find out more at heartfit.ca or give them a call, 403-870-4348. That's 403-870-4348. If you're listening and you're outside of the Calgary area, 1-877-700-4348. Long distance, 1-877-700-4348. You are listening to another edition of Talk to the Experts. I'm Betty Jo Kaiser. The expert today from the HeartFit Clinic is Diamond Fernandez. He will be back with me after this. Hello again and welcome back to Talk to the Experts. I'm Betty Jo Kaiser. Joining me this hour is Diamond Fernandez of the HeartFit Clinic here in Calgary. Find out more information at heartfit.ca or give them a shout, 403-870-4348. That's 403-870-4348. 1-877-700-4348 if you're calling from outside of the Calgary area. Today we're talking about heart health. And if you're the kind of person that has maybe had heart disease, you've been diagnosed already, you've had bypass surgery, a stent, maybe you have diabetes. There's heart disease in your family, you're stressed and you just want more information. You know, those family docs do a good overall approach to health and wellness, right? They take your blood pressure and they do the blood work and they do the basics. If you have a cardiologist, you know those folks are super pressed for time, but they definitely take it to the next level, especially if you've, been under the knife or you've been diagnosed. The cardiologists are doing fantastic work, but take it to the next level to really enhance your heart health, improve your lifestyle, and feel way better. You need to investigate the HeartFit Clinic here in Calgary, heartfit.ca. Diamond, I'm going to stop yakking because you are the expert in this area. I'm really excited about it, though, because how people feel after they have been through your clinic, they've gone through the full assessment, they've gotten lots more information about their arteries and their heart. You guys have set them up with some great therapies, and they come out on the other side feeling like brand new people.
Yeah, and the HeartFit Clinic, we love what we do. It's really great, and especially with this new treatment we have. Well, it's been around for a bit, but
new to Calgary.
Yeah, new to Calgary. We started doing it late last year. The HeartFit Clinic, what we do is we do a great assessment to see what people's risk is of a heart attack or stroke. We do that same risk assessment before our treatments. So what we're talking about is external counterpulsation therapy. And it's great treatment to help people with heart disease. Again, it's safe, it's painless, it's non-invasive, it's non-surgical, and it's just a nice squeezing sensation on the legs that pumps blood back up to the heart.
So you lie down on a
You lie
comfy
down,
bed.
yeah. You lie down for an hour. You can read a book or check your email, whatever works, and
Sure.
or go for a snooze.
Drift, yeah.
And a lot of people just go for a snooze, in all honesty, and you just go and go into your space, and this machine does all the work for you. I mean, it's great as to what the benefits are from this. And so patients who have angina, patients who have had a heart stent or bypass surgery that is now closed off, or maybe not amenable to it, or they have a lot of heart disease, meaning what we call multi-vessel disease or small vessel disease. These are great treatment options for patients now. Congestive heart failure, diabetics, or hypertensive patients, great treatment for heart disease now. Because we're giving this massive amount of blood flow back to the heart, we're able to have so much more improvement to areas of your heart.
So you put blood pressure cuffs. Are they exactly like blood pressure cuffs?
Yeah, they'll fit around your calf,
Okay.
your thighs, and then your buttocks, both legs. And they sequentially inflate it, and it pumps blood back up to the heart.
Doesn't hurt at all. It's very
No.
relaxing
Yeah.
feeling. Almost like a little massage.
Exactly. And does it towards your cardiac cycle. So every time your heart's at rest, it pumps. And when the heart contracts, the cuffs relax. And so what happens is you're able to deliver a massive amount of blood flow to all areas of your body, including your heart especially.
So it's really improving circulation.
Yes.
And so this type of treatment would work for people with kidney disease,
Yes.
hypertension. Diabetes is a big one.
Yeah. And diabetic arteries are so... they get so brittle, and it makes it more at risk for plaque building up in our arteries. And diabetes is a huge one.
Other treatments, anything in terms of if you need blood flow, increased blood flow to any of your extremities.
Yeah.
And it it's not just about your heart.
Yeah.
It's improving head to toe,
Exactly.
your overall well-being.
Yeah, and you improve circulation. So, I mean, we get benefits, obviously improving blood pressure, we get improvements in improving diabetes, but we also get improvements with sexual function as well. And
Giddy up.
But on a serious note, the arteries going to our sexual organs are a lot smaller than the arteries going to your heart.
Okay.
And so when we can improve function everywhere, obviously patients get a lot of benefit from that perspective as well.
I love it.
Yeah.
We're chatting with Diamond Fernandez. He's with the HeartFit Clinic. You can find out a lot more at heartfit.ca or give him a shout, 403-870-4348. So, Diamond, someone who's interested in better heart health, better overall well-being, better lifestyle, they're going to come to your clinic, sit down with the folks there and get a really thorough assessment. You go into way more detail, way more in depth than a doctor or cardiologist is able to, correct?
Yeah, and I mean, your family doctor is great at looking at some basic, risk profiles. They'll do some, blood work. They'll check your cholesterol, your blood pressure, whatnot. But we check your blood work in more detail. We check your artery function. We talk about how healthy your arteries are, what the age of your arteries are. That's a really cool test that we do. And we look at basically your fitness level to see what your risk is of that as well. Now, going to a cardiologist is great, but the fact of the matter is if you're not high risk, you're just going to get dismissed. And I mean that on all levels, meaning that if you've had a heart attack or stroke, now you, what we call, become stable. Well, when you become unstable is when you go see a cardiologist again. You're like, I need to call my cardiologist again. If that's the state of that, I think external counterpulsation therapy might be a better option for you, or an option that might be complementary to what your cardiologist is doing as well.
Well, you work really closely with cardiologists
Absolutely,
and
yeah.
doctors.
Yeah.
This is not instead of a doctor.
Yeah.
This is in enhancement of. It's
Exactly.
better. And if you want to take it into your own hands, be your own advocate for your own health and well-being, and take it to the next level, HeartFit Clinic is for you.
Yeah.
So you go in, you'll get this really thorough assessment, and we're talking a fitness program, we're talking diet nutrition program, but a very special treatment that's only available at HeartFit Clinic here in Calgary. Traditionally, people would have to fly down to the Mayo or Cleveland clinics to get this type of therapy, is ECP, external counterpulsation therapy. We have been discussing it at length, but it's because it's pretty remarkable.
Yeah.
It changes people's lives,
Yeah,
right?
And it's great. I mean, you lie in this bed, you do these treatments for an hour long, and you get some remarkable benefits from helping your arteries, improving the function of your arteries, allowing your arteries to grow new arteries, make new vessels, and get to areas of your heart that's demanding more oxygen.
Some folks that have experienced this often will say they feel like completely different, like almost a new lease on life. We listened to a conversation with Harry, and he just sounded like it changed him. He was so excited about how much more energy he had. He had a way better sense of well-being, and it's because of this ECP. And we all know somebody that has suffered from some type of heart disease or some type of cardiac event, and it's scary.
Yes.
I mean, heart disease, #1 killer. And there's a way you can take a hold of it.
Yeah.
You can take control of it.
And many people look for other options. They look for maybe taking different supplements. They look for
Yes.
maybe chelation therapy. ECP therapy is an evidence-based approach to your heart health. And so it's not something that's hocus pocus like you talked about. People used to fly down to the States to get this type of treatment. You don't have to do that anymore. We have this treatment bed that is here in Calgary that's helped the people of Calgary and surrounding areas improve their heart health so that they can obviously grow new arteries and really excel with how they feel.
Remarkable improved circulation. So we're also talking about folks that might have hypertension, high blood pressure. Of course, diabetes is a big one we chatted about. Kidney disease as well, and even erectile dysfunction because it helps blood flow to the sexual organs.
Exactly. And so like I talked about, you get those smaller vessels and to go into your arteries of your sexual organs. If you can improve that, you improve function everywhere, right? And so it's this mass amount of blood flow that improves a lot of patients. And patients who have angina or taking all those medications, we're able to maybe decrease the amount of dosage on those medications or eliminate them altogether because they're not having that angina anymore, and that's huge.
So if I was to phone the clinic, how long does it take to get in, to get an appointment and get an assessment?
Yeah, we're usually a couple of weeks out to get patients in for an assessment and get them all through this treatment. We're about that couple of weeks out to get people in.
So, I think the price is reasonable. When you think about what you spend a year on maintaining your car, it's pretty reasonable to get in for an assessment.
Yeah, I mean, you can't put a price on your health, and especially the results that we're able to get from patients. It's unremarkable. That's what we're able to do.
You can find out more at heartfit.ca or give them a shout at 403-870-4348. Just another minute or so here, Diamond. Yeah. What is the closing message you'd like to leave the listeners with today?
I think it's important to take charge of your heart health. I think, a lot of times we depend on our doctors, our family doctor, our cardiologist, our spouse, or our family members or loved ones, and we depend on them to be able to take care of your heart health. But the fact of the matter is that you are 100% responsible for your heart health. It's not your doctors. I can guarantee you that your doctors or your cardiologists are not thinking about you because they're seeing so many people.
Of course, they're completely overwhelmed, and they are in there for the emergent. They're looking for the big concerns.
Absolutely.
They're
and they do
saving lives.
Yeah, and they do an awesome job. We got an amazing healthcare system, but it would be much better, of course, if we can help people take charge of their heart health. And ECP therapy is going to help people here at the HeartFit Clinic.
Improve your life dramatically. Improve your heart health dramatically. It's the HeartFit Clinic. Joining me today, Diamond Fernandez. You can reach him and his team at heartfit.ca or by calling 403-870-4348. That's 403-870-4348. Or long distance, 1-877-700, again, 4348, 1-877-700-4348. You have been listening to Talk to the Experts on News Talk 770. I'm Betty Jo Kaiser. Have a great day.